Hello, my name is Lisa Norton. I am a student in the nurse practitioner program at Auburn University, and this is our Module 5 project, roles and issues of the primary care nurse practitioner. And for this project, we are to interview 2 people who are non-healthcare related affiliates and ask them some questions pertaining to the roles and the duties and abilities of the nurse practitioner. My first person that I'm going to interview today is actually my son, and I wanted to include him in on this project because now that I'm in this, I'd like to know what his perception is of the nurse practitioner. This is my son, Brad Norton.
Hi.
So, Brad, what do you do for a living?
I'm self-employed, non-healthcare.
Non-healthcare. He and his sister both are non-healthcare. Dad's a paramedic, mom's a nurse, and they're non-healthcare. So here we go. What is a nurse practitioner?
A healthcare provider who does the same duties as a doctor, but gets paid far less.
Okay, and okay, that's a good answer. We do get paid. We would get paid less, but and our duties are very similar to a physician. Here's the actual definition. Our registered. This is a nurse practitioner, a registered nurse who has acquired the expert knowledge base, complex decision-making skills, and clinical competencies for expanded practice, the characteristics of which are shaped by the context and or country in which she or he is credentialed to practice. And there is a master's degree recommended for an entry level. So
yeah.
That's pretty close. All right, next question. What can a nurse practitioner do? What can they, how do they work?
From my experience with my healthcare provider, he does the same exact duties as a doctor, but the same exact duties, yeah.
So he assesses you?
He assesses me, he diagnoses, he can even treat chronic illnesses.
Okay. So do you think nurse practitioners are just bound by clinical practice, or can they expand and go to home care?
I think that they can do just about whatever the heck they want. They can go in any field they feel like, but
so like hospitals, clinics,
urgent clinics, family health care, urgent
and
cares,
rural clinics.
And rural clinics.
Very good. All right, can a nurse practitioner diagnose your illnesses?
I just answered that question. Yes, they can.
Yeah, and I know his nurse practitioner, and he's fabulous, and he does a great job with you. So depending on state regulations, nurse practitioners are authorized to diagnose illnesses using their specially trained abilities to assess patients. And by doing that, they examine medical histories and perform an extended physical examination and get a diagnosis from their expertise involved in that. Can a nurse practitioner manage chronic and acute illnesses?
Yes, they can, and they do a darn good job of it too.
Okay, so you're talking about your nurse practitioner.
Yes, he has.
And he
does
does
a fabulous job.
Yeah. Nurse practitioners can develop a treatment plan based on the diagnosis that is individualized, considering the patient ability, history, and support system.
Exactly.
So they're also allowed to follow up on the course of treatment and make adjustments along your treatment, and that happens too, right?
Yes, it does.
Okay. So next question: do you think a nurse practitioner should have to collaborate with a physician?
In my view, I don't see why, but I guess it's always a good thing as a backup plan.
Yep, some people think that, and some states do allow independent practice, or what that is called as full practice, while others are still restricting practice in categories such as reduced or restricted categories.
Yeah.
And at this time, did you know, I don't know if you know this or not, but there are 28 states that allow full practice authority.
Did not know that.
Okay, Alabama is not one of those.
Okay.
Alabama is
Alabama is probably the most restrictive.
No, we're not. We are reduced practice right now.
Yeah.
All right, next question. Can a nurse practitioner order diagnostic tests? And that would be in the ways of labs or x-rays?
Oh, yes, of course. Oh, yeah,
Okay.
yeah, and yeah.
So in other words, your practitioners ordered lots of labs and stuff like
Yeah,
that.
all,
Okay.
yeah.
Can a nurse practitioner do simple office procedures?
Yes, it can.
All right, so we're talking about, what will we be talking about here? Like suturing?
Yeah, they can stitch up a hand, they can drain a, I don't know, something, whatever,
Yeah.
an abscess or something like that.
That's right.
And they can do all the pretty much surgical stuff that a doctor can.
Well, as far as they're educated.
Well, as far as they're educated, yes.
Okay, can a nurse practitioner write prescriptions?
Yes, but not narcotics.
Okay. Nurse practitioners, now there's a little tweaking there on that answer. Nurse practitioners can write prescriptions for medications in all 50 states, including Washington, D.C. However, independent prescriptive authority needed to write controlled substances, some states are allowing that. That's going to fall under the full practice authority.
Okay.
So sooner or later they may, but right now, all practitioners can write prescriptions, not all can write narcotics. Next question, can a nurse practitioner bill for their services? Can I, like,
I'm not sure.
well, when you go to your
Look.
practitioner, don't you get billed?
Yeah.
Okay.
Well, yeah, in that sense, yes.
Yes, okay. Services provided by a nurse practitioner may be billed the same as the service provided by a physician, and in states that are restricted, the nurse practitioner may be considered a primary provider, and added to the group of physicians already being billed from that providing group. And in states that have full practice authority, that would mean if I could practice independently out from under the doctor's collaborative services, billing takes place just like a regular physician.
Okay.
How about that?
Yeah, there you go.
Okay. And this last question, what is the difference between a nurse practitioner and a physician assistant? And I can tell you've never even seen a physician assistant.
I've never seen a physician. So
I can
I've always seen a nurse practitioner, and I don't even know why you would need a physician's assistant. That title alone just makes me sound like you're a glorified clerk.
No. Physician assistants are almost the same as a nurse practitioner.
Really?
Right. In some instances, you may come across the need for a physician assistant. However, I can verify that you've never seen one. Physician assistants work with a supervising physician under collaborative agreement. They always have a collaborating physician. While nurse practitioners are allowed, right now in 26 states, to practice independently without a collaborative physician. And that number is growing. Also, nurse practitioners are more focused on patients' holistic health, emergent care needs, and chronic condition management, whereas physician assistants are more disease focused. Like you're going to see a physician assistant if you go see
For cancer.
like an internal medicine physician for liver issues or for cancer or something like that. Also, nurse practitioner certification is met by completing 75 continuing education units and 1,000 clinical hours. The PAs are required to recertify by retesting. So I think it's every 10 years they have to retest. Nurse practitioners just do the CEUs and 1,000 clinical hours. So there you go.
Okay.
Do you have any questions?
Oh, no, but I do think that we need more nurse practitioners in this world due to how little doctors we have.
That's very good. Yeah, that's true. The number of physicians are declining every day compared to the ratio of patients they need to serve. So
Exactly.
nurse practitioners are definitely needed. Thank you so much. And swap out with your husband. Hello, my name is Lisa Norton, and this is the second part of our interview for the project for roles and issues of the primary nurse practitioner. In this study, we are interviewing two people who are non-medical related. This is my son-in-law, and this is his name is Sean Michael Flowers. Sean, tell us what you do for a living.
Teacher and musician.
Okay. Teacher and musician. Non-medical.
Non-medical.
All right, so let's get started. What is your perception of a nurse practitioner? What is that role?
I'm embarrassed to say, because you're going through schooling, that I don't rightfully know, but my perception is that a nurse practitioner is somebody who does the jobs of a doctor, doesn't get paid that, or maybe get the accolades that go along with that, but that would be my perception.
That's okay. That's a pretty fair assumption. The actual definition is a registered nurse who has acquired the expert knowledge-based complex decision-making skills and clinical competencies for expanded practice, the characteristics of which are shaped by the context and or country in which she or he is credentialed to practice, and a master's degree is recommended for entry level. That is the definition. So next question is, what do you think that a nurse practitioner can do in that role?
I think pretty much everything that a doctor can do, save for maybe, I don't think they can do surgeries, and I don't think they can prescribe certain medicines, but that's...
Okay. So the nurse practitioners provide primary acute care and special health care for patients of all ages and types. They provide care, alright, so this may not be something you realize. They provide care in homes, community clinics, colleges, schools, prisons, hospitals, and nursing homes. They're all licensed to train within the competencies and provide health care that reaches beyond that of the registered nurse. So it's a broad field. It's wide open. All right, so next question, can a nurse practitioner diagnose illnesses?
Yes.
Absolutely.
100%.
100%. Nurse practitioners are authorized to diagnose illnesses using their specially trained abilities. All right, next question, can a nurse practitioner manage chronic and acute illnesses?
I would say yes.
Okay.
Maybe. Well, it depends, I guess, on the... Maybe it depends on the illness.
On the illness? You think there's some maybe that the nurse practitioner wouldn't want to delve into?
I don't know that they wouldn't want to. I don't know where the lines get drawn.
Okay. And there are probably some out there that you probably want to bring a doctor in on. Nurse practitioners can develop treatment plans based on diagnosis and individual patient ability, history, and support system that they have going on. The nurse practitioner is allowed to follow up on the course of treatment and make adjustments as needed. All right, next question. Do you think that a nurse practitioner would have to collaborate with a physician?
I'd say from firsthand knowledge that I know that they do, so yes.
Right. Okay, so for clarification of that, there are some different levels of practice authority. There is full practice, reduced practice, and restricted practice. So some states allow independent practice or full practice while others are still restricting. Right now, there are 26 or 28 states that allow full practice authority. Did you know that?
No.
Alabama is reduced practice at this time. So in the state where we are, we have to have a collaborating physician. And if you see a nurse practitioner, which I'm sure you do, but you're about to move to New York, so I don't know what that is.
Either. I'll
So,
let you know soon.
We'll find out when you get there. Can a nurse practitioner order diagnostic tests? That would be anything
Yes.
like labs and x-rays.
Yes, ma'am.
Okay, so as a primary provider, nurse practitioners are educated and are allowed to order and interpret diagnostic testing. Can a nurse practitioner do simple office procedures? That would be like suturing,
Yes.
draining
ma'am.
abscesses, and small skin biopsies, things like
Yes,
that.
ma'am.
Okay. Can a nurse practitioner write prescriptions?
Yes, ma'am.
All right, that's true. Nurse practitioners can write prescriptions for medications in all 50 states, but only narcotics in some states.
Okay.
So some can write narcotics.
But not here in this state.
Well, I don't think so.
Okay.
Can a nurse practitioner bill for their services?
Ooh, I don't know. I don't know. I'm getting a head from the yes from the cameraman, so I'm going to say yes.
Well, if you see a nurse practitioner, I promise you're going to get billed for it.
Well, I would assume you'd get paid. I just didn't know if it was like, I don't know if it's billable hours. Like, I don't know.
I guess unless you would see somebody like in our Mercy Care Clinic situation where they volunteer their time. But if you go see a nurse practitioner in an office, you're probably going to get it. You're going to get billed, or the insurance would get filed just like it normally would for a physician. And in those states that have full practice authority, billing does take place just like a regular physician.
Great.
All right, last question. What is the difference between a nurse practitioner and a physician assistant?
I would think that a physician assistant, and I'm so embarrassed to say that, like, I don't know the definition, being that you're in my life, but I would say that a physician's assistant is somebody that would take care of maybe just blood pressure, and take care of taking temperatures and sort of that front end stuff that perhaps a nurse practitioner would have as well, and that would be my perception.
Well, and some of that's kind of true. However, the nurse practitioner and the physician assistant are pretty much along the same lines of practice.
Okay.
So the difference is a physician assistant has to work with a supervising physician, whereas a nurse practitioner, the movement is going forward where they're restricting involvement of the practicing physician. Not restricting, but giving the nurse practitioner more full practice authority. Also, nurse practitioners are focused on like holistic health, the emergent needs, chronic conditions that they're managing, whereas PAs are more focused on whatever their specialty physician is they're working with. Like they could be a cancer doctor or a liver doctor or a GI specialist or something like that. So PAs are with a specialist.
I didn't give the PAs proper props. Sorry, guys.
That's all right. I didn't want you to. I wanted to educate you. So, and then the nurse practitioner does not have to retest every 10 years like the physician assistant does. It's pretty strenuous for them. The nurse practitioner has to do continuing education units. The physician assistant has to retest.
Awesome.
So, any questions?
Just, you're going to get an A.
Thank you so much.
Yeah, I love you.
Thank you so much. I love you too. And that is the end of our interview. Thank you so much for watching.